Lori, we were talking during the break about the Baxter Regional Home Health, and you were talking about a new chronic disease program. I don't know that it's new, but it's more expanded.
Right, it's more expanded, and I'm actually coordinating that. I'm actually, for the first time, we actually have a nurse that is sort of helping, trying to promote and coordinate and focus on chronic disease.
Okay,
We've always taken care of them.
Yeah,
yeah, chronic disease is defined as any disease that it lasts for 6 months or longer.
Okay.
It is heart failure, COPD, or chronic obstructive pulmonary disease. Okay. The diseases that fall under that are things like emphysema, chronic bronchitis, asthma, that sort of thing. And then also, of course, diabetes, and that's growing in numbers, and that's a chronic disease. Some of the viewers out there may remember when I did the diabetes education program. I actually coordinated that for a while, kind of got that started before Jody Owens was there. But anyway, and so diabetes is kind of a love for me anyway. And chronic disease is one of my passions and loves. I like to help folks stay healthy there. So this was a good fit for me. And anyway, another chronic disease is cardiac surgery, because it does take a full year to get completely over that.
It really, it doesn't take that long?
Yeah, so we kind of consider cardiac surgery under our chronic disease umbrella.
Okay.
Now, not everyone takes that long, but it can take a while to get over that. And we see those folks and try to focus on keeping them healthy and in the home. All of those folks.
And that's really the whole purpose to the home health, is to keep people in their familiar surroundings, keep them in the home. But tell me, I know that we've had other folks from home health on before, and one of the things that, talk to us about when people go into the home, how you try and make it safer for patients.
Right. We look at each patient as an individual and try to individualize their care in the home for whatever they need. Okay. If it could be telehealth. Telehealth is a way to check your blood pressure, your pulse ox, your oxygen levels, your heart rate, your weight. That's all important numbers for your doctor to know. So we put that in the home. A nurse checks on that, an RN looks at that daily, and we report the numbers if we need to the doctor. And that is a free service to our patients. While you are our patient, we offer that as a free service.
So this is a piece of electronic equipment that now, how difficult is it for, let's say, some of our more mature folks that aren't technologically savvy, like the kids that are 3?
Right. It's not hard at all.
Okay.
It connects to the phone line. Now, right now, we do have to have a landline in order to put it in. We haven't got a system in place for wireless yet, but we're working on it. But they do have to have a landline. It goes over the landline to the computer, where we check it on a daily basis.
Okay.
And like I said, if they gain a little weight or the blood pressure is running too high or too low, we can schedule an extra visit. The other things we do in the home while we're there is we look at the safety.
Yeah.
Falls and safety are a huge thing. We monitor the falls in the home. We look to see what they need. We have physical therapists that come in and look. Occupational therapists will come in and look at their bathroom. We have 2 occupational therapists that will come in, just do a very focused visit on their bathroom and where do the grab bars need to be. Where does the equipment that they need a raised toilet seat? What do they need in that bathroom to keep them safe?
Right.
Because falls are a huge
I would imagine, because you're on maybe on new medication, or you haven't recovered your strength.
Exactly.
You're wobbly. All of those things, and
all of those things. So occupational therapists work a lot with the ADL, because that's their job, is to take care of the activity of daily living, that part of it. Help the patient learn how to still do their activities of daily living, but do it safely.
Right.
And then, of course, our physical therapists are in there doing the exercises with them, actually helping them get stronger, get their lower extremities stronger, their legs stronger, so that they can get back and halfway back to an exercise program. And each one of the chronic diseases benefit from some type of physical activity.
I would imagine that.
Each one. Yeah. Even if it's just sitting in a chair doing upper extremity arm exercises. The people with chronic obstructive lung disease, emphysema, people with emphysema, that helps them immensely to get their upper body stronger.
Sure, get that heart, get that blood circulating, get those lungs
any type of activity, because muscles use oxygen more effectively. And if you can get those muscles stronger, they use it even better. And they'll help with the breathing, because you need there's a lot of muscle work to breathing. You don't realize that till you're having trouble breathing.
Sure. Let's go through the steps so that everyone understands how the whole system works, and I'm going to come back to telemedicine in a minute too on that. I've got a couple more questions on that, but all right, so someone's a patient in the hospital, and they've got, let's say they've had a heart failure.
They have heart failure.
Now they've been discharged to home, but their physician says, I'm going to write orders for you to get home health. So, and hopefully they select Baxter Regional Home Health.
Hopefully, yes.
Because we do such a good job.
Yes, we do.
So we've now got Baxter Regional Home Health in the home. Who's the first person that comes through the door?
The first person that comes through the door is one of our admission nurses. And they are the nurses that do the admissions. We found that works very effectively. If you have a nurse that focuses and specializes in admissions, because they understand what they're looking for when they walk through that door. So we have, of course, any of the nurses can do admissions, but the first person that patient's going to see is an RN who specializes in home health and understands that that's a different setting than the hospital.
And they're going to determine what that patient needs?
We'll determine what the patient needs. We do a home assessment, a home safety assessment, and if we don't have an order for physical therapy or occupational therapy or speech therapy, we will ask the physician at that point for the order for that, or perhaps social work. But ideally, Donna, what we want to do and what we have to start thinking in today's healthcare environment is that from the minute that patient comes into the hospital, we have to start thinking discharge. I know that sounds strange, but we've got to think discharge, and the case managers will bear that out. You know, Sue Roden and case manager, we have to start thinking discharge as soon as they enter our doors, as soon as we decide to admit them. We've got to start thinking discharge. And so ideally, we work with the case managers, and that's part of what I do too. I work with transitions. I do try to transition them to home. And so ideally, we're making a plan, and part of that plan, so hopefully we're offering, the case managers and the discharge planners are offering home health as an option, and they're making that decision in the hospital. Now, sometimes I get up there, a lot of times I don't, because they're so quickly going home. And that's part of the changes too. And so
healthcare has, as we know, it has changed drastically.
It really has.
And it's much more balanced towards the outpatient than the inpatient.
Exactly. We're moving to an outpatient world, and patients are, especially with chronic disease, it becomes more and more important that they be in charge of their own health care. The days of Marcus Welby are gone. You can't be dependent on your doctor to tell you what to do. You need to know about your health and how to take care of it, and how to keep yourself as healthy as you can.
You've got to be your own advocate.
You do.
Absolutely.
And that's part of our role, is to help people understand that, teaching them to deal with that chronic disease and to keep themselves healthy at home. Learn those self-management strategies and to stay at home.
I imagine too, what you'd said with your background with diabetes, I mean, that's huge as far as
it fits.
How to eat, I mean, we're seeing more and more diabetes due to obesity. People aren't eating well.
We're not as active, we're not eating as well. You know, there's lots of, but my background in diabetes has been invaluable with the chronic disease program, because diabetes educators for years have known that self-management's important. You know, we were the first nurses to say, hey, we got to teach this patient how to take care of their disease. The doctor's only a small part of it. They regulate the medication. The patient takes care of the rest of the disease. And that's true for every chronic disease. There is something that person can do to be healthier.
I was going to say that would be almost across the board.
That's across the board with every chronic disease.
We all need to take responsibility for our own health.
Ask
the right questions of the physician. You know, their schedules have increased over the years. So,
and you need to help them out by knowing what you want to ask when you're there for that visit. And if you can't, then find someone who can. Get a loved one. Somebody who loves you will go with you to the doctor.
Friend, neighbor, family member, you bet.
And I have, as part of the chronic disease transitions nurse, if we have a patient that simply doesn't have anyone and they want me to go with them to the doctor's office, I have done that.
I bet you have.
Or their loved one is sick, or they can't, you know, for some reason they don't have an advocate. I have gone to the doctor's office. In fact, this week I'm going with the patient to you know, the VA clinic. So there is opportunities to, we can be a pseudo advocate for a short time.
Yes, we can.
If we need to, anyway. So.
And then also, let's go back to, so we're going step by step. And we're going to come back to those steps in just a minute. We got to take a short commercial break. Don't go away. We got lots more exciting stuff for you about home health and how it works and how you can be an advocate for your own health. We'll be right back.